UTIs, or urinary tract infections, are inflammation of the bladder or kidneys. It's usually caused by an infection such as E. coli. The persons at risk for this is going to be women because they have shorter urethras, sex because it can cause bacteria to go up the urethra, and then urinary retention because the fluid stays in there long. The signs and symptoms of UTIs depend on where the UTI is, but generally they're going to have dysuria and hematuria. Dysuria means it burns when you pee. Hematuria means bloody urine. You can also have urgency and frequency. Urgency is when all of a sudden you have to go, and frequency is when you go very often. You can also have fever, chills, and increased WBCs. These are signs and symptoms of infection. Remember, normal WBCs are 5 to 10,000, so in this case, they're going to be above 10,000. The urine can also be cloudy and foul smelling. Now, if the pain they have is suprapubic pain, meaning above the pubis, it's going to be an infection of the bladder. It's called cystitis. This is considered a lower UTI. If the patient experiences CVA pain or costovertebral angle pain, CVA is a location on your back on the bottom of your rib cage. The pain here usually means kidney pain. The other name is flank pain. Now, the fancy way of saying a kidney infection is pyelonephritis. The other name is an upper UTI. Now, the main complication for UTI is sepsis, which is a really bad systemic infection. And I'm going to tell you how this happens. It starts with a lower UTI, so suprapubic pain. Then that lower UTI moves into an upper UTI. Now you have kidney infection, you have pyelonephritis. The bacteria then go from the kidneys and go into the blood because the kidneys filter the blood, and it causes bacteremia. Then that bacteria in the blood travels all over the body and causes sepsis, which is an inflammatory response all throughout the body because there's infection. Then the sepsis can lead to something called septic shock. Septic shock is when the patient starts decompensating and they have no cardiac output. No cardiac output means the heart is not doing a good job at pumping out the fluid, and there's a lot of fluid going into the interstitial tissues. We'll talk about septic shock more at a later time. Just know that blood pressure can drop. Now, all you have to do is make sure the patient with a UTI doesn't go into septic shock. And how you do that is you monitor their cardiac output, you check their blood pressures, you check their vital signs. If the blood pressure goes down, it means they're in septic shock. Make sure you call the doctor. The treatment for septic shock is intravenous bolus of fluids, so a whole bunch of fluids really fast, and antibiotics. The fluids are going to raise the blood pressures, the antibiotics are going to treat the sepsis. Now, the diagnostics for a UTI is going to be something called a urinalysis. This is used to check to see if there's nitrites inside, which means there's bacteria in the urine, and then you also check if there's leukocytes inside. This is to check to see if there's WBCs in the urine. If there's more than 10 WBCs in the urine, it means they have a UTI. We can also do a urine culture. This is for when UTIs are resistant and persistent, and we want to make sure we do a clean catch to obtain the urine for these diagnostics. A clean catch means we tell the patient to clean their genital areas, or we do it for them. Then we have them pee in the toilet. Then we have them pee in the cup. Now, the purpose of peeing in the toilet first is to clean out the urethra from any possible bacteria. Then they hold it and pee in the cup to make sure the pee doesn't have any bacteria in it. Now, the treatment for UTIs, the nursing interventions, involve giving the patient a lot of fluids to flush out any bacteria, so 3 liters of fluid a day, putting warm compresses on their suprapubic area, this is to reduce the pain, telling them to avoid caffeine, like coffee, tea, and soda, because these are irritants to the bladder, making sure they don't have any alcohol. Another possible treatment is cranberry juice, but this depends. I looked into a lot of studies and they say it's for someone real specific, but it doesn't hurt to try. You also want to teach the patient to prevent future UTIs. You want to teach them to wipe front to back, to pee before and after sex to flush out any bacteria, not to hold their pee because this can also harbor bacteria, to wear cotton underwear and loose clothing, and to avoid perfumed paper. Now, the medical intervention for UTIs is antibiotics because it's an infection. The main one that I want to talk about is called sulfamethoxyl trimethoprim. The brand name is Bactrim because that's a mouthful. Now, this drug has a possibility of an allergic reaction, so the patient could be allergic to this. Now, they could also have something called an anaphylactic reaction, which means a really severe allergic reaction where their airway can start to close. So if the patient's complaining that their airway, that their throat is sore or their throat feels different, make sure you follow up on this because it could mean anaphylactic reaction. The other antibiotics include cephalexin, levofloxacin, and ciprofloxacin, which we've already talked about. Another drug that can be given is a urinary analgesic called phenazopyridine. This drug is not to stop the bacteria, it's just to prevent the dysuria, the burning sensation when they urinate. This is to stop that. The side effect is going to be that it turns body fluids red or orange. This is expected, and you should tell the patient so they don't freak out. You also want to tell the patient to remove their contact lenses because they can get stained from the red-orange body fluids. Alright guys, that's everything you need for UTI.